Hey guys, Dr. Josh Waugh here from Contour Clinics. We had a photo go absolutely viral on the internet recently. It was a skin boosting treatment under the eye. So we're gonna follow a treatment today and have a look at it. So we've got the lovely Tori here today, and Ash is our superstar nurse injector. You can see we've applied some numbing cream here. Now this skin boosting treatment, it's gonna be very close to the skin, and that's where your nerve receptors are. Now it's a pretty comfortable treatment, but because we are close to the skin, it's a good idea to put some numbing cream on before. So this has been on for 10 minutes. This should be almost absolutely numb before we do the treatment.
Let's get started. Lay back with me, lovely. Just gonna cleanse that numbing cream off.
So the goal of this treatment is to tighten the skin under the eyes. It's to hydrate the skin under the eyes. We target the areas under here because you can have some hollowing, you can have some darkening of the skin, and hydrated skin is what we're trying to achieve here. And hydrated skin is healthy skin. See how you can see the needle slightly tenting under the skin? That is getting right into the layer we need to do. So we're not too deep to be under the skin. We're not too superficial to see the bevel of the needle. So perfect depth here. You can see this needle is very, very small. So this would be about a 30 gauge needle. It's one of the smallest needles we can possibly use. You can see here the treatment's reasonably comfortable. We're very, very cautious when we do these treatments because we've got tiny little veins under the skin. So as Ash is doing it, she's having a look to see there's no veins directly underneath where she's injecting. So this is a hyaluronic acid filler. It's the same as all the other fillers we use. The key difference is this is non-cross-linked. So think about hyaluronic acid filler molecules like this, and there's cross-links between them to hold them together. This one's non-cross-linked, and what that allows the filler to do is to spread throughout the skin quite nicely. It acts to hydrate nicely in that area without over-hydrating and not bringing too much fluid to the area. Because this is an area that can get puffy. So you may notice when you wake up in the morning, if you haven't had enough sleep, you may be a little bit puffy. We don't want to add to that. So we want to hydrate without increasing puffiness, and that's when the non-cross-link filler really helps. So if you can see here, see how it's lots of little bumps there? Actually looks quite cool. That will go away in a few hours. So we're finished with Tori's treatment. So we started with the left eye first, and you can see the left eye is almost healed. And there's no real signs of little lumpiness anymore. There's a tiny little bit out towards the side, but I mean, we started that maybe 5-10 minutes ago, and that's almost integrated within the skin already. You can see on this side here that there's a little bit of bumping there. That'll probably go away the next 10 to 15 minutes. Now, this will look great tomorrow, so there'll be almost no signs of any of the lumpiness by tomorrow. And the best results you're looking at probably 1 to 2 weeks afterwards. There is some theories that it stimulates some collagen, can look even better at the kind of 1 to 2 month period. Now, in terms of how many treatments you want to do 3 in general. It's because non-cross-link filler doesn't tend to last a whole lot longer than normal filler, so maybe it lasts 6 to 9 months. Aftercare, we can put some ice on it, 10 minutes every 2 hours, just until she goes to bed. If we see any signs of bruising here, which we don't, Ash has been very good to avoid any little veins there, we could put some pressure on it. Otherwise, it'll be a pretty smooth recovery for this treatment.